Hello, everyone. Welcome to Beyond the Basics. This is Hallie Cloud. Before we begin, I just wanted to give you a little bit about why we're all here. Beyond the Basics is a project of the Center on Budget and Policy Priorities. It is designed to provide training and resources to facilitate enrollment in the health insurance marketplace and Medicaid. We provide these resources for healthcare assisters, advocates, state and local officials, and others who help people get and keep their health coverage. The Center on Budget and Policy Priorities is a nonprofit policy organization, and it is not a part of the U.S. Department of Health and Human Services. This webinar series is also not intended for press purposes. As always, we will circulate the slides and are recording today's webinar, and we'll post it on our website at Beyond Health Reform, beyondthebasics.org. We'll post that after the webinar, sometime today or tomorrow, and we'll also post any additional resources that we talk about today. I will put a PDF copy of the slides in the chat as soon as we're done with the intro, so you all can follow along that way. Next slide, please. All participants are in listen-only mode and are muted. So there'll be just too many people on the webinar to do live questions. So what we'll do is to ask a question, you click on the Q&A icon in the control panel at the bottom of your webinar screen and type your question into the box. We're going to be monitoring the questions throughout the webinar, so you can type them in whenever you'd like. And we'll pause a couple of times for Q&A during the presentation. We are definitely not going to be able to get to every question asked, but we will have a record of all of your questions, and we use them as guides for future resources and presentations. And as always, if you have an individual question that does not get answered and you would like it to be, you can email us at beyondthebasics@cvpp.org, and we can individually answer your question. So for today's webinar, it's part 6 in our Open Enrollment 10 series. Today, we're going to provide guidance on how to help applicants complete the marketplace documentation requirements, and we will explain how to prevent data matching issues from occurring. We'll also go into how to resolve them if they do occur. Today's presenters are Shelby Gonzales, who's the Vice President for Immigration Policy here at the Center, as well as Jenny Sullivan, Director of Health Coverage Access, also here at the Center. So with that, I'm going to turn it over to Shelby to start us off. Thank you again, everyone.
Thank you, Hallie, and thank you so much, everyone, for joining this webinar today. As Hallie mentioned, we're going to start by talking a little bit about data matching issues. And just so you know, I'm going to be speaking in general about how the ACA marketplaces do document eligibility. But a lot of what I'll be sharing, it's very consistent with what happens at Medicaid and CHIP agencies at the state level, as well as what happens at state-based marketplaces. But oftentimes you're going to hear me refer to healthcare.gov, it looks like this, healthcare.gov does roughly this, that kind of thing. But in general, a lot of the requirements that I am speaking about in terms of electronic data matching and about which eligibility factors must be verified, it's pretty consistent across the different insurance affordability programs. Next slide, please. So in general, there are going to be certain aspects of a person's circumstances that have to be verified through the application process. And just to remind us all, when somebody is completing an application, whether that's a Medicaid, CHIP, or marketplace application, they are attesting under penalty of perjury that they are indeed providing truthful and accurate information, and a lot about what they put into the application, it's just accepted as the correct and honest information. And then other aspects of information that they provide about their circumstances must be verified. So an example of something that could be relevant to an eligibility determining factor that's just taken oftentimes, certainly at the marketplace level, state residency or more specifically at the marketplace level, it's really residency within the marketplace service area, which effectively is state residency, is accepted without any further evidence for the most part. At the marketplace and Medicaid and CHIP, for the most part, that's the same, is true. It's normally a self-attestation, but there is a little bit of variance there where states have the option to under, with some constraints, they can ask for some additional documentation. Other factors must be verified, and in general, the principle is that the state and or marketplace has to try and maximize the use of electronic verification to verify the claim that an individual is making on the application. So examples of things that must be verified in some way on the application, include things like income, citizenship, immigration status. And then we're going to walk you through in more detail about how that's done. But as I mentioned, kind of the first step is that the applications will take a lot of information that's provided by the applicant and then will begin to match against information that's held by different trusted resources, a lot of which are listed here and that are known as trusted entities. Next slide, please. So, all of these entities, the way that it works is that an applicant puts in their information, right? Their name, their phone number, their date of birth, relevant numbers that are asked for in the application, like a social security number when it's relevant and those kinds of things. And then that information is kind of pinged against records in these different data sources that were pictured in the last slide. And sometimes that works and it's great, yay, that's good news. And then the applicant can keep on going and progressing, and there's no issues or no need to provide any additional documentation. But sometimes the applicant is paused in terms of the information that they provided is not matching up perfectly with the information that's available in the different data sources. And that is when we call a data matching issue. That is what happens when a data, when we say DMI or data matching issue, what we're really saying is that the information provided in the application was not able to be substantiated through this data matching, electronic data matching process that the application goes through. When there's a data matching issue, it does not mean that the person has lied on their application. It does not mean that, it doesn't really mean much at all, because there's so many different reasons why a data matching issue could occur. In some cases, believe it or not, data matching sources, these entities, their information is not infallible. They have different limitations, right? There could be a variety of reasons, like when an individual's information is checked, with information in, that's held by Treasury. Well, if they didn't file taxes in the past couple of years, well, there might not be enough information to verify that the information that's provided in the application. Another example is that there are a lot of people who become U.S. citizens through what we call the naturalization process instead of because they were born in the U.S. And that might mean that their information, it cannot be electronically verified through the same process that people who were actually born in the U.S. They can have their status verified in that way. So there's a lot of different reasons. Sometimes, for example, some of the data sources that are more commercial, maybe there's been significant changes so that the data about their employment may not be up to speed, up to date with what the current circumstances are. Maybe the person has more hours of work or less hours of work, or maybe there's a change in their household composition. Maybe they had a baby, maybe one of their children became an independent adult, is no longer part of their tax unit. A lot of things could happen. People get divorced, just, people's lives change. They're impermanent, and the data sources don't always reflect the current circumstances. So there's a variety of reasons why a data matching issue could occur. Next slide, please. So what happens? So when a data matching issue occurs, an eligibility determination notice will be given to the individual that indicates that more information is going to be needed from them. In the marketplace, generally the person is given the opportunity to enroll, so they can still select a plan, they can enroll in a plan, and oftentimes they can even get, most of the time I'll say, most of the time they can even get an advanced premium tax credit and cost sharing reductions while they are resolving this data matching issue. So I will give you an example later of when an individual can enroll, but they can't get, a premium tax credit and cost share reduction during that time. But for the most part, people can get it during that time. So consumers, if the data matching issue that occurs is relevant to their citizenship or immigration status, they have 95 days to resolve that data matching issue. And they can stay enrolled during that time. And when APTCs and CSRs have been awarded correctly during that time, they can utilize that help to pay for the premium during that time. When an individual gets a DMI for any other eligibility factor, most of the time that's income, then they are eligible for 90 days. So it's usually a 95 or 90-day DMI period where people have time to resolve that issue. Next slide, please. So when an individual, I already mentioned that they will get a notice on their, what we call the EDN, which is eligibility determination notice, but they'll also get something that pops up on the screen that indicates to them that you are going to be enrolled, but your eligibility is temporary, and they tell you a date, by when you need to take action. And they'll give you more information on the EDN about what steps you need to take. Next slide, please. And then when we're talking, this kind of describes the kind of process steps in terms of notices that an individual would commonly get if they are enrolling through healthcare.gov. This might look a little different in state-based marketplaces, and certainly going to look different from, from an individual who's applying for Medicaid or CHIP directly through their state. So what the marketplace does is that they send the applicant some warning notices at different periods of time. So it's like 90, 60, and 30 days before the DMI period is scheduled to end. They also do some follow-ups with emails and text messages. They will even do outbound phone calls, trying to get in touch with the individual before there is, before the expiration date comes up. They're going to request additional documents. Just so you know, sometimes individuals do respond to the request for additional documentation, but sometimes they might not provide sufficient information. And if that's the case, they will get additional, notices that more information is needed, that, that we got what you gave us, we need more information. And oftentimes we'll also have a telephone call go out. And if the data matching issue is not resolved, there will be sent what we call an expiration notice. that means you're going to lose coverage, or you're going to lose your APTC. So think about it from the perspective of, an individual who has an expiration of a DMI because of immigration or citizenship. That means the marketplace doesn't have enough information to even allow them to stay enrolled in a plan. That means when they're going to see an expiration, they're going to be losing coverage altogether. Whereas an individual who has a DMI that is expiring about their income, that is going to make them ineligible for advanced premium tax credits. That doesn't, but they can still stay enrolled in their marketplace plan. They might not want to, because it's going to be a big sticker shock, right? If they no longer have an APTC, but that is the way it goes. You lose eligibility for what your DMI is applicable to. And if the DMI is resolved, there will also be a notice sent saying, all good, you can proceed. And next slide, please. So I'm going to go over first a little bit about verification of citizenship and immigration status, and I'll turn it over to my colleague, Jenny. Next slide, please. So first, we'll look at how the process works to verify citizenship. So as I mentioned, an individual goes to the application, they provide information, right? A citizen generally will have a social security number, and they'll be asked for a social security number in the application. In the application, they will also be asked to attest if they are a US citizen or national. And if they say yes, then what healthcare.gov will do is that it will try to substantiate your claim of citizenship against records that Social Security Administration holds, right? So what they're going to do is they're going to send certain factors like your name, birth date, Social Security number, those kinds of things. And they're going to say, Social Security Administration, can you substantiate this claim of citizenship? And if it can't substantiate citizenship, the applicant is then going to be asked if they are a naturalized or derived citizen. So, like I mentioned before, right, Social Security Administration generally does a really, really great job at being able to verify citizenship for individuals who are US citizens and that were born in the US. They have some limitations for older individuals, people starting about my age, my late 40s. If an individual is my age, roughly, or older, generally, if they were born outside of the US, the Social Security Administration oftentimes can't substantiate their claim of citizenship. That doesn't mean that they're not citizens. It just means that simply the way that the data set it was designed back then, and because the way that Social Security Administration wasn't designed to be a way to verify citizenship for Medicaid and CHIP and Marketplace. It was set up for a different purpose, right? So there are some limitations, but a whole lot of people can get their circumstances verified quite easily and effectively this way, but there are certain people that can't. So if that is the case, and Social Security, this data match does not yield a positive result, the next question that will be asked of the individual that's applying is whether or not they're a naturalized or derived citizen. And if they say yes, then they're going to be asked to provide information that is contained in either their naturalization certificate or certificate of citizenship. And then that information, when it's provided, it's going to be used by healthcare.gov or other marketplaces to verify against information that is in the Department of Homeland Security's Systematic Alien Verification for Entitlements program, which we oftentimes refer to as the SAVE program. Next slide, please. So when an individual, for whatever reason, still can't be verified. And to be honest with you, I once did a little very informal poll of my family on a Thanksgiving, because that's how much fun I am on Thanksgiving. And I asked my family, which the vast majority of which had been individuals who have certificates of naturalization. I said, quick, if you were to be filling out a healthcare.gov application today, how many of you can pull out your certificate of naturalization and give me the relevant number right away? And they all looked at me and said, you are no fun at Thanksgiving. But they also said that this would, some of them, don't get me wrong, they were like, I could immediately do that in about 5 minutes if I was at my house. And then most of them, they're like, oh gosh, I don't even know where that is, So don't take it for granted that a lot of people are just not, that are in this situation, are simply not going to have that information readily available. Or like, let's say they're going to come over to your location and you're going to be helping them apply for insurance. They might not have thought to bring their certificate of naturalization or certificate of citizenship with them. So these are individuals who might get a DMI in their application. Always best to be able to try and avoid a DMI when possible. So if that means they're going to go back home after their appointment with you, they know where their naturalization certificate is, and they're going to call you, and then you're going to log back in and you're going to put that number in, or they're going to put that number back in to the application and then resolve it that way. Yay, like do it, right? Like that's a good thing. But sometimes a DMI is going to occur. And if that's the case, then individuals will have to verify their citizenship. And they can do that by sending in documents. And in some cases, the documents that they send in, it's going to be sufficient to send in just one document, and it takes care of the whole thing. And examples of that, unfortunately, are few. And they're listed here on this screen. Things like their US passport. A lot of people will be able to do this with their US passport, and then you submit it, you upload it to the application, and that should be fine. Other items that are also listed here, including the state issued enhanced driver's license, which is now available in one more state than used to be even a smaller number. Other documents, including, a tribal enrollment card, so there are different things, but in general, always best to be able to really try to not get a DMI. If so, then they're going to have to submit one of these documents, and not everybody has one of these readily available. In the next slide, the other option that I'll show you another option. When people don't have those documents that can clear what we call both the citizenship and an identity verification document, then they need to do both. They need to accomplish two things to really satisfy the citizenship documentation. You would need one document that's listed here on the left side of this table, that is really seeking to verify citizenship. So things like a US public birth certificate is verifying citizenship. And then there's other documents here as well. As you can see, there's a long list. And then you would need a second document on the right side of this list that really is the end result of it is really trying to verify identity. And then the two documents together then constitute the requirement for verification. So like I mentioned in the slide before this one, you just have to submit one of those documents, and it's sufficient to be like, all is good. You have done you've together, this is enough to do the citizenship, both aspects of the citizenship. It's done. Identity plus citizenship. On the next slide, you need one of each. A little bit more complicated. Next slide, please. So how does the marketplace verify immigration status? So in this case, we've got Jane again. And let's say that Jane was asked, we saw earlier, Jane was asked whether or not she was a US citizen or national, and she said yes in that example, but now this is a different Jane. And this Jane said no in that example, and then she's going to be asked, does Jane have an eligible immigration status? And I can tell you that no one, no one is born knowing whether or not they have an eligible immigration status. Okay, that is not like it is something you would have to learn, right? Because those are tricky words. Eligible immigration status is really seeking to find out whether or not you have a status that makes you eligible for the benefit program that you are applying to get coverage through, right? And to be honest with you, Jane doesn't even know what program she's going to be eligible for at this point in time, during the application for the most part, right? I mean, you might have a guess that she's going to be eligible for marketplace coverage and not Medicaid, but we don't know for sure, right? That happens because the application figures that out. The way that this works, so I'm describing this to you because it's important for you to know that this is not perfect. It's pretty good, but it's not perfect, okay? So if you were to click on the link on the application, and you can see that there's a link there, right? On healthcare.gov, if you were to click on that link, you basically would get a list of all of the statuses that would qualify somebody for marketplace coverage. There would also be a way to figure out, through maybe clicking through, it's listed in different ways and different times. So I'm not sure how it's going to be listed by the time you all are helping people apply for insurance in October, November, and December, right? But in general, you're going to see an exhaustive list of statuses that would qualify somebody for ACA marketplace coverage. That if you listen to the last webinar that I did with my colleague Gabrielle, we went through all of those different statuses, and you can go back and look at either our resources on healthcare.gov, or you can even go on to healthcare.gov. I'm sorry, our resources on health reform beyond the basics. Healthcare.gov has a list of the statuses. There's lots of places you can find the statuses. If Jane says, yes, I have an eligible immigration status because she saw this list of statuses and she's like, yep, I see myself there, right? Then she's going to be asked to provide to select which kind of document that she has as listed below. And if she has one of those documents, then she's going to be asked to provide specific numbers. I cannot be stronger about how important it is that information be provided on the application. And I say this because, and I say this in two ways. One, I know that it's not always going to be super easy to figure out which number you need to provide in the application. I know that it can be challenging. I can also assure you that having a DMI related to immigration status can be really, really, really challenging. And if there is something you can do to help avoid that, then I would really, really try hard to do that. So we've been hearing that there's been an increase in data matching issues related to immigration status, and in particular, a lot of individuals that have arrival departure records, the I-94, I-94A, that those individuals have been leaving off their relevant numbers, and there have been an increase. There's been a little bit of an increase in terms of data matching issues for many immigrants, and we know that this is kind of a slow walk then. And many times, how I mentioned earlier, most people can still get enrolled during a temporary period while they provide documents. A lot of immigrants who get a data matching issue, a lot of them will either end up being sent by mistake to Medicaid, because the system is going to think that they're Medicaid eligible and not marketplace eligible. So temporarily, they're going to try and send them over to Medicaid, even though that might be the wrong place for them, especially if their document is I-94. That's a good example of somebody that might not be Medicaid eligible. The other problem is that, or they might just be told that you can enroll temporarily, but you can't get any benefits in the meantime. So I'm just doing a big commercial here, really, really, really encouraging you to really try to find, of these documents, which one does the individual that you're helping have, and trying to really help them through, making sure that those document numbers are input into the application. Next slide, please. And in this slide, next slide, please. Before I get to the next slide, I should tell you that there's a lot of reasons why this still might not work. Let's say that you have input the document numbers because you heard my commercial and you're like, okay, I was told, put in these numbers. And you put in the numbers, but, look, I'm going to be clear. Like, sometimes it's confusing and you're not sure which numbers to put in. We have some resources both on Beyond the, Health Reform Beyond the Basics that help kind of navigate through, like, here's the number you should be looking for, and healthcare.gov has similar resources. I would take the time, take a look at them, try to gather the right information so that you don't input the wrong numbers. I would, like when you're putting in other numbers, like a social security number in the application, I would ask, like, put it, when you're typing it in, type it in, and then repeat back, this is the number that I put in. Is that right? Just because it's super easy to make a little bit of a typing error, right? There's other errors that could occur. There could be date of birth issues, there could be names that are misspelled, or there might be just changes, maybe on their document they have a hyphenated name, but they only gave you one name, or they, when you're filling out the application, or maybe they gave you the nickname, but they really need to have the name that as it appears on their card. So I would try really hard to ask them, when you're filling out the application, what is the name? Is that the name that's used on your, you name it, right? Your Social Security card, or the name on your I-94 or on your passport, that kind of thing. That might help. Next slide, please. So like I mentioned here, and in the next slide, we have the different kind of documents that individuals might have, and then the relevant number that they're going to be asked to provide on healthcare.gov, okay? So here it's we just tried to match it up so that it's pretty easy for you to see what number you're looking for, so that you can then grab from the document and put into the application. In the next slide, we just have another list of more, documents. In the next slide, we, how I mentioned, we have a reference guide that shows, like, here, this is, and this is, like, how I mentioned, is tricky, right? It is super tricky because, like, the application might ask you for like an alien registration number. That might be the language that they use, but you see here on this card, that oftentimes people that have lawful permanent resident status, or otherwise known as a green card or an I-551, well, it's labeled as USCIS number. So it's going to be important to be able to either use our guide or the guide that's updated on healthcare.gov as well, because otherwise it's going to be a little bit of a mystery as to figuring out which number are they talking about, So so we really recommend maybe you make a copy of it, just have it there on your desk so that it's easily available as you're helping people. Next slide, please. Okay. So if an applicant is not able to prove their citizenship or immigration status, they have 95 days before their coverage is terminated. And if they submit their documents after coverage has been terminated and they resolve their data matching issue, they can come, they're eligible for special enrollment period to re-enroll in coverage. And the SEP will begin the day their DMI was resolved, and they will have 60 days from that date to re-enroll in coverage. So they can either retroactively, if they had to have to pay, obviously, right? Like they could retroactively, so that if they had a gap in coverage during this time, they could retroactively get covered. Like maybe they had some medical expenses during this time. Maybe they were in the middle of treatment, who knows? Or they could do this prospectively as well. Next slide, please. We're going to go through an example, but I'm going to go pretty quick because I've used a lot of time. So we've got a family, Roberta, and Monica, and they're married. They have 2 kids. And Monica was born in Germany. So she's one of those examples. She's a US citizen. She was derived. Her parents were US citizens when she was born, but she was born in Germany. Roberto has been a lawful permanent resident for 7 years. And Miguel and Elena were born in the US. Let's see what happens. Next slide. So all family members provide their social security numbers on the application. Monica, Miguel, and Elena attest to being US citizens, right? Because they all are, Roberto's not, right? Monica's asked if she's a naturalized or derived citizen, and she says yes. Monica does not have the certificate of citizenship, so she skips the questions asking for the document numbers, so she doesn't have those numbers to provide. And Roberto attests to having an eligible immigration status, and he provides an A number, but he doesn't have the card number. So he only provides a partial part of the information. Next slide. So this is what the matching results are in this hypothetical example. It doesn't always have to occur this way, just so you know. In this case, Monica, when they tried to do a data match with SSA, we know that wasn't successful, right? That's why she was asked whether or not she was a derived or naturalized citizen. And she said yes. And then they tried to match with SAVE, but they can't match with SAVE, right? Because she didn't provide the numbers. Roberto, the SSA match isn't even applicable to him, right? Because he's not a US citizen. And he was not successfully matched in SAVE. We're going to say this hypothetically. Oftentimes, providing just the A number would be sufficient. We're just, in this case, we're saying that he provided the A number, but not the card number, and that wasn't enough. We're going to just say that to be clear, like we should always provide as much information as we can, because that will strengthen your chances. But I just don't want you to come away thinking that if you oh, forget it, we can't put this in. I would still try. I'd try and put in what you do have. And if all you have is the A number for whatever reason, I would put that in. Miguel and Elena, they did their data match. Their data match went through with the Social Security Administration. They were born in the US. By the way, children who are born in the US oftentimes are not going to have an issue with they will have their citizenship very successfully matched with an SSA match. That's just generally what will happen. There's always cases that might not. Misspelling of the name, different names, human error, who knows? Next slide, please. Eligibility results. So Monica and Roberto are instructed to provide documents to prove their status within the 95 days, and all family members are approved to buy marketplace plans and were awarded advanced premium tax credits in the interim, right? And we know that both Monica and Roberto were asked to pick a plan, and to pay their premium, but they also need to provide some documentation to prove their citizenship and their immigration status respectively. And the next slide, please. Monica and Roberto get warning notices and emails explaining their coverage will end if sufficient documents are not provided. So like I mentioned before, there are going to be different notices that are provided. I'm going to try and go through this pretty quickly, but you have this as a reference. So I am running out of time. But in this case, enough to say that in our scenario, Roberto does provide sufficient information, or I'm sorry, the information is not sufficient on either case. So next slide, please. Roberto sends in a copy of his LPR green card and he's going to be fine. That's going to resolve the data matching issue. Monica does not have a document from the list of options provided on her eligibility notice. So she does not send additional documents, and her data matching issue is going to expire. She gets a notice indicating as such. And then next slide, please. We're going to say that Monica loses her coverage, and she can still regain her coverage if she sends in necessary documents, like I mentioned earlier, right? So so we're going to say that she's no longer covered as of May 1st, but then she spends the day at the DMV getting herself a new, document that proves her identity, because she needs to provide both of those, right? If she can't provide the certificate of citizenship, then she needs to provide two: one that provides that, something that proves her citizenship, and then something that proves her identity. She gets a driver's license or a walking ID or whatever it is from her DMV. She goes back to healthcare.gov, she uploads a document, she clears the DMI. The DMI is resolved, at the end of May, close to the end of May, and she's now eligible for special enrollment period. And she has the option, right? She can either do this, with her coverage beginning at the beginning of the following month, or she could have coverage and APTC retroactive to May 1st. So that is her scenario, and being able to regain coverage after a DMI has expired. Next slide, please. And I'm going to turn it over to Jenny.
Okay, great. Thank you so much, Shelby, and thanks, folks, for hanging with us. I know this is weedy stuff, but that's why it's important. So now we are going to talk about another type of verification that can lead to data matching issues, verifying household income. So, as you know, applicants attest to their expected income for the upcoming year when they apply for coverage during open enrollment. So this year, people will attest to their expected income in 2023. They have to do this for every person and every source of income in the household, even for people who are not applying for coverage. Important to underscore that. These attestations then are usually matched with IRS tax return data in the Federal Data Hub. The most recently available data they'll have for this coming open enrollment year will be from 2021, since we're in 2022 now, and most people, of course, won't file their taxes for this year until next spring. But this does present a few complications. Of course, there are always complications, right? Which we will talk about later. So as with citizenship and immigration status, there are lots of reasons why income might not be successfully verified using data matching. Perhaps even more so than citizenship and immigration status, income is volatile. Your wages can change, the hours you work can change, your job can change from one year to the next. So it is not uncommon for people to have a different projected income than the data that's available in the hub. And this is also a case where we're still seeing the ripple effects of the pandemic and the economic downturn. Lots of the categories here, categories of income could have fluctuated a lot between 2021, when, if you remember back to those times, we were still very much in the throes of the pandemic and the economic downturn, and 2023, looking ahead to next year, when for some people, economic recovery might have begun to take hold. So lots of sources of income, lots of reasons why those sources could change from one year to the next. And the other reason is, of course, there might just not be tax data available for somebody. Maybe they didn't file taxes in previous years. They're new to the workforce. They were out of the workforce for a few years. There's lots of reasons, again, to underscore Shelby's point earlier, a data matching issue, whether on immigration or immigration status, citizenship, or income does not indicate that the person is not telling the truth or that their information isn't valid. We just have to resolve that because the reality going forward doesn't match what's in the data hub. So in general, the DMI rules for income are in place to guard against someone receiving more APTC than they're ultimately eligible for. And this, of course, protects enrollees from owing large sums back when they reconcile, and it also protects the integrity of the program. So if someone's income has gone up, this typically does not trigger a data matching issue, since it would result in the person getting a lower premium tax credit. The application just accepts this change and on you go. But if someone's income has gone down, this could result in the person getting more APTC. Now, to trigger a DMI, a data matching issue, it has to have gone down by a certain amount. And I am here to tell you today that these thresholds have been updated for this coming year. These are different than what you may have experienced in years past if you are a veteran assister. So if someone's estimated income has gone down by less than 50% or by less than $12,000 compared to their income in the data hub, remember it's probably their 2021 tax data, then this does not trigger a DMI. But if their income is lower and it falls outside of those thresholds, so the difference is more than $12,000 and more than 50% of the income amount that's in the data hub, then this will trigger a data matching issue that the person has to resolve by submitting additional documentation. These new rules widen the range of allowable income fluctuations and will likely mean fewer income-related DMIs going forward, we hope. The old thresholds were $6,000 or 25%, so we've essentially doubled them. Now, some people still get financial help if they qualify for it based on their new lower income. They just have to provide documentation to verify that the change has happened or can reasonably be expected to happen in the coming year. A DMI is also triggered if there's no income in the data hub for the person. And I already mentioned that. Okay. So how does a person go about providing documentation to substantiate this drop in income? Well, I present you with a list. You're used to seeing lists like this by now. These are mostly tax documents that you can use to show a change. But you can see that in some cases, the person might also be able to use other forms of documentation like pay stubs or bank statements. And these are all listed at the healthcare.gov link at the bottom here. And of course, you'll have a recording and a copy of these slides at your fingertips should you want to reference them. So the marketplace does also have some good resources to help people document their income and resolve these kinds of DMIs. We've got a link here to their consumer guide for annual household income data matching issues. And it's got some good worksheets inside, particularly for folks where their income might be more complicated, like people with self-employment income. And then it, again, includes the list of documents you can use for income-related DMIs, et cetera. And they walk through some examples. So this is another good example or a good resource to have. So we've established there are lots of documents you can use to prove income, but these aren't always easy to obtain. So if the documents aren't readily available, the consumer can also submit a written signed explanation as an acceptable form of documentation. And you don't actually have to prove that the other documents aren't available. There's no double jeopardy here. You can just submit your written explanation. It's an equally acceptable form of documentation. And this doesn't need to be a long, complicated ledger with lots of accounting. This can just be a simple explanation with the key info the marketplace needs, like the application ID number and the applicant's contact information. So you can see in the example, Lydia says, hey, I'm starting school in the fall. I'm quitting my job in August. My job pays this much, and this is how much I work. But starting in August, when they quit in August, this is how much they will have made, but they're not going to continue working for the remaining months of the year. This is enough. This is a sufficient example of something that would work to resolve a DMI. So let's look at a little bit more complicated example. We've got a married couple, Eva and Kai. Eva works part-time at a radio station and Kai is self-employed. In 2021, Eva made $22,000 at her job and Kai reported $32,000 in self-employment income. Their total income, therefore, was $54,000, and this is the amount that's in the data hub. But in 2022, Kai lost their best customer, which cost them a serious income hit. After deducting allowable business expenses, they only expect to make $18,000 in 2022. So when they apply for 2023 coverage, they attest to a total projected income for the coming year of $40,000. This is $14,000 lower than their income on their 2021 taxes. But this is more than $12,000 and less than 50% of their income in the hub, that $54,000 amount. So it does not trigger a DMI. Let's flip the script a bit and look at an example that would trigger a DMI. So same couple here, Eva and Kai, same 2021 income of $54,000. But in this case, 2022 was a hard year for Kai. Partway through the year, they stopped working to care for an aging parent, and they took a significant hit in income. They still have caregiving responsibilities, and they only expect to make about $2,000 for the coming year. The couple decided to take $2,000 out of an IRA as well to help make ends meet while their income was down. And remember that counts as income because it's a taxable source of income. So when they apply for 2023 coverage, they attest to a total income of $26,000. This is $28,000 lower than their income on their 2021 taxes. It's more than $12,000 and it's outside the allowable 50% threshold, so it does trigger a DMI. So here's what happens. Next, Eva and Kai reported their income as $26,000 on the application, so the marketplace is going to provide them APTCs based on that amount. But their eligibility determination notice will note the DMI and tell them they have 90 days to submit documentation of their income. If they don't submit acceptable documentation within 90 days, the marketplace will revert to using their 2021 income as the basis for determining their APTC. Now, they might not lose their financial help altogether, but it will go down and they're eligible for more. So we should resolve it and get them what they're owed. So how can they resolve this DMI? Like most households, they have some options. Eva could submit her most recent pay stub. Kai can submit a business ledger to show their business income and expenses for 2022, and they can submit documentation of the IRA withdrawal. But maybe in this case, an easier approach would just be to submit a statement describing what's going on. So they can do the math, write a short explanation, including that they don't expect to replace the lost income in 2023. And remember, even if only one household member has a significant change in income, it's critical to explain all the income sources for the household as part of any explanation, not just the ones that are changing. So as I mentioned with the example, if an income DMI isn't resolved in 90 days, the APTC will be changed based on the information in the hub. But if there isn't information available in the hub at all, the APTC will be terminated altogether. The household can continue to get their coverage, but they'd have to pay the full premium, which, as we know, is likely to be unaffordable for the vast majority of marketplace enrollees. And you want to be especially careful if someone has set up an automatic withdrawal to pay their premiums, because they might not notice that these changes have taken place until they've already started being charged or having the higher premium deducted from their account, which is an unhappy surprise. Or if the person is invoiced for their premiums and they don't pay, they could fall into a grace period and risk losing coverage. So it's important to stay on top of these changes and get things resolved as quickly as possible. Oops, skipping ahead a little bit. So a consumer can also request additional time if 90 days isn't enough. They have to call the marketplace call center, so this is for healthcare.gov states, and demonstrate that they've made a good faith effort to get the required documents. But the simplest route is the one that we've already talked about, which gets you around all of this, and that's to just submit a written explanation and accounting of what's happening. So a person can resolve their DMI by submitting documentation, submitting an explanation, or even by going into the application and correcting their income projection to align with the data in the hub if they realize that their initial projection was incorrect. Now, I wouldn't recommend doing this if this doesn't reflect the truth of the situation. We want them to get all of the help for which they are eligible, but sometimes people do the math differently or aren't counting income sources that they should or shouldn't. So you can resolve it that way as well if that's the truth. And even if the 90 days has expired, which means their APTCs have likely gone down or gone away altogether, if they submit documentation, then they can restore them. They can also file an appeal to the DMI decision, and if they're successful, they can get PTCs retroactively. If they're unsuccessful, they can still get PTCs back for the gap months when they file their tax return, assuming that it corroborates their new lower income. But that means that they will have had to remain enrolled throughout those months again and pay the full premium, which very few marketplace enrollees are in a position to do without financial help. So just one more example here. This is Andre. He's never filed taxes before, but he attests to an annual projected income of $24,000 for 2023 and applies for coverage. He says, I'm going to file this year. But since he's never filed, there's no past income information about him in the hub, so a DMI is triggered. Now he misses the notices about needing to provide documentation to resolve the DMI, so his APTC and cost sharing reductions both were terminated after 90 days. Remember, because the marketplace doesn't have any past year income data for him, they can't just reduce his APTCs because they don't have a basis for continuing to provide them at all. So Andre learns that this DMI has had this effect, and his coverage has been his APTCs have been terminated when he gets the higher premium bill and faces higher out-of-pocket costs when he gets care, because remember, he was getting the cost sharing reduction, so he had become accustomed to a certain level of cost sharing. So what can he do? He can submit documents to verify his income and restore his APTC and CSR, premium tax credit and cost sharing reduction. He can also appeal. If he lost coverage, he would need to appeal to regain coverage. But unlike citizenship and immigration, for those DMIs, there isn't an SEP if Andre loses coverage due to loss of premium tax credits. Luckily, it is pretty straightforward. He can submit the information needed to resolve his DMI, and if his appeal is successful, he can get APTCs and CSRs retroactively or prospectively. He has a choice. And then finally, we've hit this one several times, but he could stay on the plan and just pay the full premium and pay the higher cost sharing amounts when he gets care, and he'd be able to claim the PTC back when he files his taxes for 2023, but you don't get CSRs back. That's you have to be enrolled in a CSR plan and be accessing services using that plan. You can't claim them retroactively. So it's really not an ideal situation for Andre because, again, we want to make sure he's getting all of the help for which he is eligible. Okay, so verification of other minimum essential coverage. This is just briefly, we'll talk about another kind of verification that can lead to data matching issues. And this is less common, but it's when there's an electronic match with the with the state Medicaid agency, with Medicare, or with OPM, the Office of Personnel Management. That's for federal government employees. And this can trigger a DMI if it shows that someone applying for marketplace coverage is enrolled in or eligible for another form of minimum essential coverage. And if that's true, the applicant will have to prove that they're not eligible and not enrolled in that coverage in order to enroll in a QHP, in a marketplace plan. And it's hard to prove something isn't true. So just these can be tricky, but the person can enroll in coverage with their APTC based on their attestation, but it's critical that they submit the documents requested to prove that they're not eligible for or enrolled in other forms of coverage. Now, this can include a letter from an insurer with a termination date. It can include a termination notice from a Medicaid or CHIP agency, but you need some sort of proof to show, in fact, that they are not enrolled in this form of coverage. And we do get follow-up questions from folks that get caught in the crosshairs with these. So I'll just underscore that these are less straightforward to resolve. And if they are not resolved in 90 days, the person will lose APTC because it's a condition of getting APTC that you don't have another form of minimum essential coverage. So very last thing here, there's also something called a periodic data matching issue that can trigger a DMI. This happens during the coverage year, so not during the open enrollment period, but throughout the coverage year. The marketplace is checking to see if people are enrolled in other forms of coverage, Medicaid, CHIP, Medicare. And if a person is found to be enrolled in one of these programs and they're getting APTCs, then they'll get a notice from the marketplace. And this is the important part here. In this case, they have just 30 days to resolve the issue before their APTCs are terminated. So if you get a mid-year periodic data matching issue, then you really need to resolve that as soon as possible. Now for Medicaid and CHIP, if the person is actually enrolled in Medicaid or CHIP, the periodic data matching notice asks them to end their marketplace coverage. If they're not enrolled in Medicaid or CHIP, then the notice tells them to update their marketplace application. We'd go into the sort of report a life change part of the application to do that. If the person doesn't act, again, the APTC will end and the consumer will be billed for the full premium. Because remember, we're canceling their APTC, but we're not canceling their marketplace coverage altogether. Those two travel independently. For Medicare, the marketplace will terminate APTC, but leave the marketplace plan in effect at full cost, or if a person elected to have marketplace coverage end when they become Medicare eligible, then the household enrollment in the marketplace plan will be terminated altogether, including APTCs. And that's another important thing that we could probably spend a whole separate webinar talking about interactions with Medicare. But if the marketplace plan is terminated in this case, then the other members of the person's family who are not moving to Medicare would get a special enrollment period to re-enroll in coverage. I'm sure I've sufficiently confused folks by now, and I know we're a minute over time and have a little bit more content for you. So if you can stick around, please do. We will record this. If you can't stick around, then the recording will be at your fingertips as soon as tomorrow on our website. So thank you for listening, and I'm going to turn it back over to Shelby now.
Thanks, Jenny. And in these tips, next slide, please, I'm going to kind of go through them quickly because a lot of them I already talked a little bit about the importance of really kind of double checking the name and the birth date and asking the individual, how is your name? Is this the way that your name looks and appears on the different documents, and that kind of thing will really go a long way. And there is the part of the application will even allow somebody to update their information if the information does not match the information that's on the card. So there are some different options for that. But again, it's worth it to double check things. I've heard all sorts of stories of like the birth date being wrong, or like 2 numbers being off in the Social Security number or immigration card. All of those things could happen. Next slide, please. Finally, we give some information here about how to, when you're uploading documents and when you're mailing in documents, we just give you some general kind of information about how that should be done. Next slide, please. We're going to go a little bit over identity proofing on healthcare.gov. Just to be really clear, you know how I talked about identity as part of the verification process for citizenship? That is different, okay? It gets super confusing because we talk about identity in 2 different ways, right? Identity as it relates to part of a citizenship verification requirement is not the same thing as what we call identity proofing. And identity proofing is not an eligibility requirement. It really simply is something that's done to really protect the consumer's information on their application and the consumer's information, because you know how I talked about this application is kind of like a live application that is reaching out and verifying information in real time with information that's housed in other trusted sources like other government entities, okay? So if a person can't complete identity proofing, it should not impact their eligibility, but it will impact their ability to utilize different functionality within the online application. They won't be able to submit their application online if they don't have their identity proofed. When we go into the application. Instead, they would have to submit their application either over the telephone, or I don't think anybody does this, but maybe through the mail, but it's just not going to happen by hitting submit in the application. They won't be able to select the plan online, and they won't be able to report changes online. So it's important to have somebody in the application be identity proof, but it's not an eligibility factor. Next slide, please. So online, what healthcare.gov is going to try and do, it's going to provide some custom questions similar to what you've probably experienced, either by helping somebody in healthcare.gov or when you're opening up like a bank account online or something else, where they're trying to make sure that you are who you say you are. And basically when applications do this, they're basically taking information from your credit history, and then they're going to ask you, they ask you some information about yourself, and then they try and match that information with information like that. They'll give you some questions that you'll have to, that they call challenge questions, and you'll have to answer the questions to the best of your ability. And then they're trying to figure out whether or not you are who you say you are. People who can't make it through that step in the process, which some people who don't have any credit history won't. They won't even be able to, the system won't even be able to ask them challenge questions. Other people, if they don't, other than credit history, people who don't have credit history, there might be people who've had their identity stolen in the past. That might be another reason why they don't have a credit history. They might have just moved to the US. That might be another reason. All sorts of reasons why people can't have this happen. If that's the case, some people will be instructed to call Experian to complete identity proofing over the telephone. And they will be, if they pass it through the telephone, then they will be given a unique reference code, and they'll be asked to, provide that unique code on the application. Other people will not be able to go through that step, and they might be given the option to upload some kind of documentation, so they can send in some kind of document that proves their identity. And they can, while that's being processed, they can continue to complete the application and even submit the application, even select the plan over the telephone through healthcare.gov's telephone call center. So, especially as deadlines come up, I would suggest that people go ahead and proceed. Even though you still want them to eventually clear that identity proofing, because it's going to make things a lot easier for them in the long term. But you all know the people that you're working with better than I do. I know that when I ran an outreach program, I would say, like, I do everything I can when I see this person, because I may never see or hear from this person again in my life, right? Like, this might be their one opportunity. They're busy. They have a lot going on. I would get this as far as I can while they're here with me. And going through the call center is a good avenue. Next slide, please. So what are different documents that people can submit to prove their identity? Here's one more list, lots of lists. Here's a whole lot of documents that people could submit. If they don't have one of the ones on the left side, they might have to submit two of the ones on the right side of this form. Next slide, please. And so again, as I mentioned, there are going to be some people who are going to be given the option to upload their documents. If they do, you can do that. And in the meantime, you can work with the marketplace call center, the healthcare.gov call center, or whatever your state's marketplace call center is. And I would complete the application as much as possible. You can put in a lot of information on the application, but when it comes time to really hit submit, I would pick up the phone, call the marketplace, and then have them push through the application so that it's finalized over the telephone. Next slide, please. We provide a lot of resources here, and I'm going to turn it back over to Hallie.
Thank you. And again, we'll answer just a couple questions. You guys have really good questions. So if your question is not answered, you can always email us at beyondthebasics@cbpp.org. But I did want to ask just a couple of questions. This first one is actually for Shelby. So if someone has applied for a social security number, or they're sort of in the process, they're waiting for proper documentation, they've applied for citizenship, they're in the process of getting this documentation, but they haven't received it yet. What should they do on the application?
Well, for the social security number, anybody who doesn't have a social security number should just leave that question blank. They should never put in a number in the meantime. If they're applying for Medicaid and they are in the process of applying for a social security number, they should tell the Medicaid agency that they have completed that. The Medicaid agency might ask them for like that proof that they have applied, and they should still be able to get benefits pending the issuance of that social security number. And the marketplace, they should still be able to just proceed without the social security number. and they should be able to get benefits pending. They might be asked to provide that Social Security number.
Awesome, thank you. One more question on documents. Would an expired U.S. passport qualify for an acceptable document for citizenship eligibility?
So Hallie, I actually saw that question come in and I started to look because I cannot, the honest answer is I can't remember. I actually think no. I think that it has to be current, but it's just something that we're gonna have to double check because I don't know for sure.
All right, we'll put a pin in that one.
Yeah.
And then we'll do just one more question. And again, if your question is not answered, feel free to email us at beyondthebasics@cbpp.org. Is any additional time provided to people who submit documents and then receive that insufficient document notice? So they get a DUI, they submit some documents, it's not enough, they receive an insufficient document notice. Are they given additional time after that?
I think that you should operate under the assumption that that you should not be waiting until the end, right? It's like you shouldn't like, oh, good, it's day 90, I'm going to submit my documents. Like I would try and get this done. That's why you have a long period of time. I think that if you were on day 90, I would call the marketplace and see what could happen, but I wouldn't count on that. In the case of a DMI that expires for immigration or citizenship, you might have an expiration that occurs because you submitted insufficient documents, and then you go and then you miss the end result, the end window. You have the option to retroactively enroll into coverage. Look, none of that is fun, right? Like retroactive anything it can be challenging to occur. I think your best bet is to do everything you can to really finish all of this data matching during the window. But whenever you're in the situation when you either miss a window or there's insufficient documentation warning notice and all of that stuff, I would pick up the phone and call the marketplace and find out if you can get more time.
Awesome, thank you. And just a very quick clarification of something that popped up that we just want to kind of hit. Someone asked a quick question. So people without an SSN cannot qualify, and that is not true. You can qualify without a social security number.
Correct.
Yeah.
If you're not there's a lot of people who are not eligible for a social security number, but they do have an immigration status that does qualify them. So SSN, no SSN does not equal no marketplace coverage.
Exactly. And this is a good plug for our webinar on eligibility based on immigration status, which is a good partner webinar to this one. That is posted on our Beyond the Basics website. And we'll also send it around with this particular webinar. Thank you again for all of your questions and for sticking with us today. We know this went a little bit long, but it's a lot of really meaty content. Again, we'll be distributing the slides, all of the resources. I know that the links aren't live on the Zoom toolbar, so all of the resources will be posted to our Beyond the Basics website. They should be up later today or tomorrow morning. We have an upcoming webinar on Thursday on the auto renewal process. And then next Thursday, we're going to do a big webinar on just sort of tying all of these rules together. So it'll be lots of examples, lots of different things all together. And then we have a very, very special webinar on Thursday, October 20th, that will be entirely in Spanish, and how to assist people who primarily speak Spanish. So we're really excited about that one too. You can register for everything on our health reform beyond the basics.org/events. Yeah, and I think that is everything. Again, if you have any questions, need assistance, please email us at beyondthebasics@cbpp.org. And thank you again for being with us today. We hope to see you on Thursday. And with that, I think we'll bring this to a close. So thank you so much, everyone.